For those of you who don't know me, haven't been to one of these before, my name's Russell Cartwright. I've worked in NHS communications for more than 24 years now. I currently split my time between a half-time role as Head of Communications, Engagement and Behaviour Change at NHS South East London ICB, and working as a consultant, supporting and training in-house public sector teams to run impactful behavioural science-led campaigns. And in the last 16 months or so, I've set up this public health comms hub with the really helpful support of Can Digital. And I think we're at the stage now where we've got over 450 members. And the whole concept is about making a kind of space for collaborating for those of us working in public health comms, really. So we've run several of these free webinars. There are recordings of all of them available on the hub if you want to catch up on any. And we share resources, solve problems together. Just a little bit more about me. I'm really passionate about the impact that public health communications campaigns can have when, and the caveat to that is when done right. And the role that we as communications, public health communicators can have in helping to deliver the prevention agenda and ultimately helping people live healthier and happier lives. This webinar itself is the second of these webinars with a punk rock theme, and I'm just going to share my screen briefly. I really wanted to, for this webinar, I really wanted to grow a Mohican, but as you can probably see on the screen, I'm a little bit beyond that. It's a little bit difficult for me at this stage. So I thought I'd ask Photoshop's AI to draw a picture of me with a Mohican, and that's what Photoshop came up with. So there you go. I'll stop with that now. There is a serious matter behind the punk theme, and there is a reason for that. At the last one in December, I talked about, and we looked at some of the evidence around what I class as a national scandal, where millions and millions of pounds are wasted each year on public health campaigns, on channels and on tactics where there's no evidence that they work, and that is such a waste, and it does often lead to a bit of a perception that public health comms campaigns don't work at a local level, and I've seen that they do work and they can have impact as long as you do them right, which is the key thing. So today I'm joined by some colleagues from Can Digital, who I'll ask to introduce themselves shortly. They're going to share with you some tips, some tactics, and things that have worked for public health campaigns. And just to say, really, for me personally, collaborating with Can was an easy decision to make. There are many of you probably already know Can, but if you don't, there are when you work with them, there are no frills, and it's certainly not all about vanity communications. They all share my passion for following the evidence and helping public sector teams make the most of the resources that they've got. So basically stopping or doing much less of the stuff that doesn't work and doing more of the things that do work. So yeah, like I say, it was a really, really easy decision to make to collaborate with Can. So on that note, John Paul, would you like to introduce yourself?
Hello, everybody. Yes, I'm John Paul from Can. Thank you, Russell, for that very kind intro, and thank you for letting us, support this hub. It's exactly what we care about, as you say. I've worked for Can for over 10 years now, and have helped lots of public sector organisations improve outcomes from campaigns. And I'll be sharing a little bit about one of the key features that enables that to happen shortly.
Thank you. Alan, would you like to introduce yourself?
Thank you, Russell. I'm Alan Watson. I'm the Customer Success Manager at Can Digital. I've been with the organisation for just over 2.5 years now. Prior to that, I worked at Enfield Council for 13 years in the corporate communications team. During that time, I did a lot of projects relating to public health, a big one being the response to the COVID pandemic. Thank you, Russell.
Thanks, Alan. And Dalbia?
Thanks, Russell. I'm Dalbia, and I have been working for CAN for about 2 years now. And again, like Alan, my background has been in public health, and I worked in public health for about 25 years in various roles, including comms, the old-fashioned way, print, mail shots, and then I progressed into doing events, and then eventually I became a sort of a web user experience expert, and this has been a revelation for me in terms of working for CAN, because it's been great in terms of spending money on things that work, which is something that, you know, as public sector organisations we might miss a trick with. So that's me. Thanks, Russell.
Thanks, Dalbia. I'm just going to put on another slide, 1 second. And this is an adaptation of a slide I used at the last Punk Rock webinar, and I kind of I alluded to the millions and millions of pounds that are wasted, and that being a bit of a scandal. But there's a number of reasons why local public health campaigns fail. And often it is lack of data or lack of adequate measurement and evaluation. There's no shame in this. There's a bit of a knowledge gap with some of us. Online digital advertising is a fastly moving place. It's hard to keep on top of it. We've all got day jobs and other priorities from our organisation. So sometimes the knowledge gap plays into it. Sometimes we choose the wrong channels. Sometimes the messaging isn't great, or the messaging isn't informed by behavioural science, which is my passion. Bad choice architecture, where we take people, maybe not having clear calls to actions or too many calls to action, that can all impact on it. Often, and I talked a lot passionately about this last time, but often, we're contacted by some unscrupulous and convincing salespeople who convince us to put our money into places where there's very little evidence that they will work. And I've witnessed it. They are really convincing. So I think always question those approaches and ask for the evidence. There's an element of doing what we've always done, and there's always pressure from others, members, councillors, leaders to kind of be visible. And everybody likes to see stuff on bus stops or whatever. But where's the evidence that this works? Another thing that often contributes to campaigns not quite achieving the impact they had, and I've mentioned this already, but seen it so many times with so many case studies, that you come up with, people may invest in research and insight. They might really kind of get their head around the problem or the problem behavior that they're trying to change. And they may develop something really creative. They might develop, some really good messaging that resonates with their target audience, that maybe, if we're talking digital, drives them to some action, which is to click on that advert. And then what happens is they take them to a landing page, which is, on our corporate websites, which aren't always the best. They can be quite sterile. They can be very corporate. And people get hit with, 20 choices, or the calls to action don't really jump off the page. And, as a result of that, the campaigns fail. So, and I've seen that time and time again, really good campaigns that take people to a place that, just doesn't inspire any action at all. And it's, and I guess often you get feedback from those campaigns, and you'll get hit with lots of big numbers about the people you reached and the people who clicked on and what have you. But ultimately it is all about the action that people do take. So, you know, the place that you take them, and that information choice architecture is really important, and keeping that as simple as possible. I'm going to bring John Paul in, who will probably add to that, and also talk about some of the ad tech and how that can help.
I'm going to be talking a little bit about campaign plumbing, which is getting the right connections in place for your campaign to make it work. I'm also going to address the dreaded term AI, or more specifically, machine learning, and how you can unleash that to improve campaign performance. And we're going to look a little bit about an example in terms of search. Just in terms of and why we're talking about these subjects, we've run over 3,000 campaigns for the public sector. And so we have this sort of unique viewpoint on what works, and also a very clear idea of what gets in the way of brilliant campaign performance. 108 is the biggest campaign collaboration we've done. We've got a small campaign collaboration going in smoking cessation at the moment with a few of you, but 108 was the number of councils that took part in our foster care recruitment campaign a while back, and 277 times is the proven difference in performance between broadcast channels and some of the targeted digital channels that we've been able to demonstrate in some campaigns. You may have seen on previous webinars me show that. I wanted to start, however, very quickly with communications principles. Now, these are designed to be borrowed, nicked, adapted, and shared. But in running all of those campaigns, we come across a range of things which, if we'd filtered for initially, performance would have been improved significantly. So firstly, inclusivity. Has 90% of your target audience been reached? Are you telling stories that are compelling and that connect with people? And do you have a mix of human, physical and digital in everything that you do? So that principle is overarching and should frame most of your campaign planning. There are many lights hidden under bushels, beautifully designed, but vast majority of target audience not seen it. Huge problem, and with digital very, very fixable, as long as you have that human insight and that physical element to it as well. Everything we do in public sector comms saves money. You know, early intervention, reducing waste, connecting campaigns together for multiple outcomes. That's why people invest in it. But we can't tell whether we've delivered impact if we don't have the data. So that idea of a tree falling in a wood and no one hears it, did it make a sound type thing, if we're not measuring, we don't know. And almost number 3 is the most important one, and that's what we're zooming in on today. If you don't have that, you can't prove your impact, and you don't know whether you've been inclusive or not. And so I wanted to sort of zoom in on this particular element. Now, in the many campaigns we've run, and probably in your careers, some of these things might seem familiar. A service saying, yes, of course we will supply outcomes data. We need to install these pixels to do remarketing, you know, optimize and measure. Oh, we're now going to get stuck in individual policies, long processes to get authorization and so on. We've got this landing page, but on a mobile device, it looks dreadful, and you have to scroll through about 5 reams of content before you get to the outcome. Too much information. And also in terms of forms, collecting one's, and I'm being playful here on purpose, but dentist's ethnicity is not required to create a campaign outcome. So before a campaign even goes live, you're wading through all of this stuff. And what that often means is that we go live and we don't understand what's going on. So we start to report on vanity metrics, reach, clicks, that sort of stuff. So we don't have any familiar situations. We're not getting outcomes data. We're getting stuck in internal data processes. User experience is not particularly good. Collecting too much information. That's before the campaign gets started. So when we go live, we're not seeing what's going on. So we can't see what's going on in the box. And so we report on those overarching vanity metrics, which is bad, because if we can't prove our outcomes, the relationship between the service and the communications professional isn't as strong as it could be, put it that way. It erodes trust, and people then don't make the case for investing in communications. So just to zoom in on these barriers, we've got user experience, in brackets, landing pages. We've got technology blockers, and we've got disconnected data streams. These are fundamental barriers to delivering campaigns that prove impact and therefore make themselves investable and help us make the case for them being always on. Now, there are very few silver bullets or panaceas in our world, but in this area, there really is one. And that is off-site campaign landing pages. They do a number of things. Firstly, we can strip them right back, make them really accessible, and make them look good on mobile, which is the vast majority of traffic you're going to receive. Then, because we've stripped them back, your outcomes start flowing through, and we can feed those outcomes back into reporting and to optimization. When someone lands on these pages, we can put the full suite of ad tech on those pages to help the machines learn, and I'll explain that a little bit more in a moment. Which means that over the course of time, we can reduce cost per outcome. Or another way of saying reduce cost per outcome is more outcomes for your budget. So more impact, more lives changed, more evidence of communications working well. I want to drill a little bit into that point on AI or machine learning. Now, we hear a lot about AI. I have a number of feelings about, isn't this just technology going a bit faster? AI has that terrifying element of, is it going to come for all our jobs? Being talked about it in a war context, things like that. I think it's much more helpful to talk about machine learning. And that is equipping machines to understand how to solve problems much more quickly. And the biggest example of this is in the programmatic marketing space. So buying adverts on digital platforms, be it social, search, news, YouTube, whatever, and being able to give it a task, a defined outcome, to then design a campaign, to then program it into those platforms, to then run experiments, which then those experiments have a digital feedback loop, a landing page, a form, something like that, which we can then optimize and then reduce cost per outcome. Now, all of these platforms, Snapchat, Facebook, Instagram, Meta, Google, so on, they all have this machine learning capability. But when we don't install the technology, the feedback bit doesn't work, which means that you only get to the experiment level. And you never get beyond experimenting. You can't optimize, and therefore you struggle to reduce cost per outcome. And this is a common facet of the vast majority of the campaigns that we run. So it's a sort of awkward, uncomfortable truth, but it's something that is actually quite fixable and quite easy to sort out. And Dalby is going to show us an example of this in action in a moment. So I wanted to get us to think about that, to think about landing pages and how this sort of works. And I just want to talk you through a very specific example. So we've got someone on the platform. I mean, that is my photo, and I was just searching to lose weight fast. But when people are doing this, we can place search advertising against those results. As you can see here, there's an ad for Richmond and Wandsworth's free health check. Now, if I click on that ad and I go to the landing page, the richmond.gov.uk page, it may be that there aren't the right pixels on that site to detect and tell Google whether I landed and whether I went on to do something else. And the most important thing here is that conversion. So when I sign up for the health check, we need to trigger a conversion pixel which tells Google, well done. I don't equate this to sort of evil robots. I equate it much more to an enthusiastic golden retriever puppy, right? You're giving it a biscuit every time it does something, and it will then repeat that behavior and do it faster and all the time. And that's what we're trying to do with these platforms. So having the tech in place on a landing page means we can tell Google how to do its job better and how to guide it to do its job better. So it's one of these wonderful feedback loops. Couple of points. Some of these platforms will actually reduce your cost per click if this technology is in place. And so that means more outcomes. You unleash machine learning to optimize your campaign for you. And so your cost per outcome goes down over time. And you can also demonstrate that happening. I'll just skip back a few slides. That graph is orange is outcomes and blue line is interactions. And so we're able to reduce interactions or reduce interactions per outcome over time. At the end, it clearly went a bit skew-if, but that's for another day. So just if we could just take from this, that this plumbing, this landing page user experience, this ad tech on those pages, this ability to unleash machine learning on your campaign is probably one of the most transformational things you could do after stopping wasting money on channels that don't work. Also, you'll be able to see what works yourself much better and improve what's delivered. So often in campaigns, a lot of the budget and resource goes into paid channels that kind of we know aren't really generating that much in terms of interactions and outcomes. If we're not measuring, we don't have that measurable place, we can't prove that. And then often a lot of the heavy lifting is done by digital channels with a small proportion of the budget, and that delivers most of the outcomes. And where we can move if we have these landing pages in place is towards this situation where we reduce investment in stuff that we know doesn't work and increase investment in the stuff that does. And what does that mean? That means more outcomes for your budget. That means more proof of impact. That means more return on investment, which means communications becomes more investable. So thinking about that, just that ad tech, that plumbing side of things, when you and us work together, we help remove all of those barriers. You can then see what's going on, and a conservative estimate of campaign performance, we can times it by 10. As you saw, 277 has been achieved, but we can really make that happen. So I just thank you for your patience with my technological problems, and hopefully that was useful. But if there's one takeaway, it's that landing pages and that ad tech to unleash machine learning is absolutely transformational.
Thanks, John Paul. It's fascinating stuff, and I mean, it does. I talk to people in my kind of role about this, and people get a bit frightened by it working in the public sector, or a bit scared. And is it ethical and things like that? Well, it absolutely is. You know, this is all technology that the private sector are using. You know, a heck of a lot, and possibly they are using it in not always the most ethical ways. But what we're doing with public health is you know, what we're doing is taking that technology and using it for a good purpose. So, you know, you should feel very comfortable exploring and developing that. I'm now going to bring Alan in, who's going to talk a little bit more about some of that and talk a bit about so building an audience and targeting. So Alan.
Thank you very much, Russell. I'm just going to share my slides quickly. Apologies, I've got a slightly wonky IT setup today, but yeah, hopefully everything goes okay. So as Russell said, I'm going to give you an overview about audience building and targeting, a quick overview of how you can target, also a few case studies of campaigns that I've worked on in the past few months. So in terms of targeting options, so all of the programmatic platforms have some kind of targeting options. So Snapchat is probably the one with the fewest targeting options. Quantcast, which is one of our the web display platforms that we use, has the most, with literally thousands upon thousands of different audience segments. But in terms of the key options, so geographic is a big one. So most platforms are postcode prefix. Some go down to 1 kilometer radiuses. Others postcode sectors. Demographic is a big one as well. So age and gender. Interest is another one, really interesting. So Meta has around 1,000 different interest segments, Google about 2,000 for ads on websites, and then yeah, Quantcast, like I've just said, has literally thousands. Behaviors is another one as well, so you can kind of get messages out to people with a particular interest. So it could be people that are keen recyclers, environmentalists, etc. And then the final one is languages. So both Google and also Meta offer language targeting, which will mean that you can get ads directly to those people that are using specific language settings on their devices. So again, another way to reach potentially hard to engage audiences. So how to target. So there are three key ways that you can target through a campaign. So the first one is to use platform audience segments. So that is yeah, essentially selecting options when you set the ad up through the platform. Then there's lookalike audiences. So using a lookalike audience will mean that you reach the kind of people that visit a certain website or list of websites. And then finally retargeting. So retargeting is a really interesting one. You'd probably be familiar with it. It's basically when you've been on a website, say for example an e-commerce website, put something in your shopping basket, then close the web page down, and you see ads appearing for that item or similar items afterwards. That's a really good method for obviously encouraging people back onto the website. It's particularly effective when there's a long kind of decision-making journey. So for example, quit smoking, where people might not necessarily take immediate action, but because you know they've been on the website, then you can encourage them back onto it again to kind of pick up their journey. So what I'm going to do now is give you some examples of campaigns that I've worked on. So these are all very recent in the last few months. I've got outcome data for some of them, but others I'm waiting for data on. So this is a campaign that I worked on with NHS North East London, focusing on encouraging people to use online services. So with all of these campaigns I'm going to talk you through, there will always be a kind of broad, audience group strategy that we use AI. But in addition to that, I added some other strategies that were kind of focused on more niche audiences. And for this campaign, obviously, given that it relates to digital, it made sense to focus on people that were tech savvy, so might be using digital for, say, online therapy, online shopping, etc., etc. So I developed an audience profile for people who are interested in tech and a kind of digital first mindset, but also interested in health as well, to kind of hopefully encourage them to make better use of NHS online services. In addition to that, I developed an audience profile that was targeting older people with an interest in tech, because older people might be more likely to need to use NHS services, and it will help them access them more effectively. So the campaign saw over 25,000 website visits, nearly 25,000 website visits over a period of 2 months. And what we're waiting for is data to come through in terms of the impact. Because obviously being an awareness campaign, there was no guarantee that people would actually need to use NHS services immediately. So the next campaign is one that I worked for NHS South West London. So it's an inclusive recruitment campaign with the aim of encouraging EDI audiences to submit forms regarding work coaching, help with job applications, etc. We ran 2 Google search strategies for this campaign. So one was focused on low income areas within the SWL catchment area, and then a second was focused on those looking for terms on Google relating to inclusive employment, LGBT friendly businesses, etc. And the results were really good. So this campaign is currently live, but the current figures are showing that the cost per website visit was £1, and the cost per inquiry through a CAN landing page and form was £2. So really, really pleased with the results, and the client's happy as well, which is obviously incredibly positive. So the next campaign is actually, this is more focused on an audience, two audience profiles that I've developed that I've used with multiple clients. So this was focused on medical conditions and the immunosuppressed as well. What I did was I got access to the NHS Green Book condition lists and built audience profiles. So one on long-term medical conditions and then a second on immunosuppressed. So the audience profiles would be allow us to reach those with an interest in the conditions as opposed to exactly those with the conditions. So likely to include those with the conditions, but also their friends and families, etc. as well. I've used the audience with a number of different clients, and yeah, the cost per click is good, between £1 and £2. But again, waiting for actual data to come back in terms of outcomes. So the next one is NHS South West London. Can has worked with the organisation for a number of years now. And at the moment, I've got a live campaign with them, which is focused on pharmacies first. So the campaign has a big element focusing on reaching an audience of people that don't speak English as a first language. So videos were supplied in multiple different languages, kind of the key European and Asian languages within the SWL area. And we ran ads on Meta, which achieved a cost per click of 60 to 80%, and also ads running on YouTube as well. With a 40 to 50% engagement rate. If your objective is driving traffic through to a website and you're using video, I would definitely recommend focusing on Meta. But if you're running ads on, if you're running ads for general awareness, and this was one of the campaign objectives, then YouTube is a really good way to get the message out. So I just wanted to talk about a couple of forthcoming campaigns that I'm working on at the moment that might be of interest. So one is working with a county council on a scheme to encourage people to sign up to a project to help with childhood obesity. So for this campaign, we're running strategies targeting parents kind of quite broadly across the county, but also parents in low incomes, and also parents with an interest in unhealthy food as well. So that campaign is going to be live in the next couple of weeks. Secondly, a really interesting one for me, and I'm really looking forward to this, is a campaign targeted running on Google search to target Romanian language speakers. So those people that have got their Google set up in the Romanian language, to encourage them to register with a GP, because my client is having problems encouraging Romanians but living within the area to register. So it'd be really interesting to see what the results are like for that campaign. And then finally, another campaign that's coming in is sexual health related, where I'm building an audience of those with an interest in dating apps and associated terms. So another one that I'm really interested in, and yeah, looking forward to getting those three live. That's it from me, Russell. If you have any questions at all for me, do shout at the end, or drop me an email. My email address is Allan, ALLAN, @can-digital.net. I'll be around after the main presentation to answer any questions. Thank you. Over to you, Russell.
Thanks, Alan. Some really good examples there, and it's really good to see the actual outcomes. You know, it's so much better to spend their money in a targeted way rather than spending more money and hoping that the people we're trying to reach see it. You know, some really clever ways of doing that. I'm now going to bring Dalbir in, who's going to talk about something very close to my heart and that I'm currently working on as well, which is smoking cessation work and some ways of generating leads on that.
Thanks, Russell. I'm going to share my screen. So can everybody see that? Yeah. Cool. Right. I'm probably going to talk a bit about the detail of some of the campaigns that we've been running at CAN. The one that I'm going to feature is around smoking cessation, which is what Russell's just mentioned. We're running it for Coventry Council and Warwickshire City Council using platforms like Meta, Snapchat, YouTube and Google Search. We've done some targeting around some of the areas and looking at lower incomes, and we've used specific postcodes within both of those areas, both of those boroughs, something that, you know, Alan was mentioned earlier. Now, when we started running the campaign initially, it's been running since September, we discovered that the landing page didn't really, you know, a bit what Russell said earlier, is that it had a lot of information on it. And I think what made it a difficult situation for us was that there were two boroughs on the page, and there was two types of signposting. So there was different numbers, different form filling. So what we decided to do, even though they did get impressions, we wanted to make it that much better. So what we decided to do was suggest a landing page, which they agreed to. And it was, again, use their branding, but we made the landing page very, very simple, a few questions, and then it's straight to a submission, which made life a lot easier for them. This actually developed a lot of impressions, a lot of click-through rate, but what we did notice the difference was we actually managed to get some submissions from actually having that landing page, and it also included pixels as well. So from the landing page, we thought that was great, and we thought, yeah, we're getting some real outcomes data here, and we're getting some real submissions, but we wanted to do better. So what we decided to do was run some in-platform lead gen forms in Meta and Snapchat, and we want to experiment to see if that would work. This is something that we've been doing in foster care recruitment, and it's been one of those things where you don't need to click away from a separate web page. You know, you're still within the realms of the platform. And you're not having to do that extra click, which made a massive impact for whatever reason. So what we did was we ran the video. It then went over to again a few simple questions, and then as we went through it, what we realised also was the contact information, because you're already in the platform's already got your information, so it auto completed all the data, which made it even quicker. And then obviously everybody's a bit worried about you know, it being ethical. From what Russell was saying earlier, there's a data privacy covered in there referencing both Meta and council policies. All submissions are received by the council team, and can continue to offer support to them. We did a very similar thing with a lead gen form within Snapchat, again running the video, again a few more questions, and through to submission. And we discovered, by experimenting with some of this stuff, we realised that actually submissions were going up, and Facebook proved to be really, really good. You can see from what JP was saying earlier in our conversation at the beginning, was that we weren't getting really some really good outcomes data. So, you know, it sort of flatlined a little bit here. Great integration and interactions with the ads themselves, but no submissions. So from like the 7th of November onwards to the mid of December, we discovered that the landing page was actually working really well, but we wanted to do that a little bit more. So we decided to do these in platform lead gens, and to our amazement, from the 6th of January, which is when we started, we've had over 167 lead gens specifically just from Meta. Snapchat didn't work as well, but Meta really was the one for us. So benefits. Just to mention, actually, on the submissions, there is a question mark around the quality of some of these submissions, and we're working with the services to find out, you know, what kinds of people are actually filling these forms in, and are they actually wanting to sign up for this quit smoking service. Now, the benefits, to me, this this, in my mind, it sort of demonstrated that there was a desire and a need for people wanting to quit smoking, but they just needed that little nudge. It achieved better quit attempts, which means cost per lead is lower, which is what JP alluded to earlier. It was outcomes driven, so you can see what the impact of the spend is, and it was something that we can switch on for you. If you so wish. We're already working with another county, and what we would like to do is have this campaign sort of ends at the end of March, and we're hoping to continue it for another 3 months, because what the approach that we want to do is to have a steady stream of sign-ups at a pace that service can handle, so they're not like bombarded with something that they can't cope with. It means that they've executed the objective more successfully. It increases quit attempts, and ultimately better health goes up for your residents. So thank you for that, and give me a shout if you want to connect with us and run something and make that impact in your area.
That's great, thank you, Dalby. It's definitely some food for thought for me as I plan my smoking campaign in South East London. I've got one question from me actually, which is when you're running the lead generation adverts on Meta, do you also run generic ones where you're taking people to the landing page as well? Do you give people kind of like both options, or?
Yeah, absolutely. So with the ads themselves, we're running them through to the landing page, but also the in-platform lead gen forms as well. But we're running various strategies, and search was one of them as well. So the search one, if anybody was searching for wanting to quit smoking, they would end up at the landing page. But if it was a Meta ad, then we'd feed them the form solution.
Yeah, thank you. It's really interesting to see people filling that forming, actually, because my instinct would be that people would be really cautious about giving any details while they're in Facebook or Instagram, but it seems like people are doing it, which is brilliant. Can I just ask Dalby or Alan if you've got any kind of closing thoughts or anything that you just wanted to say before we finish and before we take any final questions?
Thank you, Russell. Yes, I'd just like to add thank you all for joining the call today. And if any of you are working on campaigns and need further information about targeting or the potential for different platforms, etc., do get in contact. Obviously, as JP mentioned earlier, we've worked on over 3,000 campaigns now. So we've got a huge wealth of data and insights, so we can help share information with you about what's worked and what hasn't, and go into more detail about specific campaigns and targeting if there are any kind of niche audiences that you need to reach through your work. Just get in contact, and that's it from me. Thank you.
Dalby, anything from you?
No, I think Alan said it all basically. I just want to make sure that people are aware that this sort of paid media element is actually making a real outcome. It gives you outcomes data which you can then evidence back to the service areas and the seniors within each local authority that actually these things are working, as opposed to doing bus ads, which I know, like we mentioned earlier, Russell, it seems like it's a vanity exercise. So when we were running the Coventry and Warwickshire one, the seniors within Warwickshire County Council, they still ran bus adverts at the same time, which I thought was quite interesting. But they would never have known what the impact was. So you just need to have that in your mind when you're running campaigns and you want to see real evidence, and you can prove that the campaigns that you're in are working.
Thank you.
That's it. Thank you.
No worries. There's no further questions, but I mean, just to kind of conclude from me, what I would say to people is, just don't. This is rapidly moving. Things are changing very quickly. Don't just get stuck in the doing what you've always done, especially if you've got very little evidence that it works. You know, there's so much that can be done to make the most of your budget. There's also, you know, you could argue, I mean, organic social media stuff is very, very limited now in terms of reach. It's really hard to actually have much impact, yet that we spend a lot of effort on that. You know, you could argue that we'd be better off focusing on less and putting small budgets to some of this, you know, targeting of specific audiences. But you know, by all means, do reach out, have a conversation. It doesn't, you know, a conversation doesn't cost anything around what might, you know, to pick people's brains and get ideas for what you could do differently. Just like to say a massive thank you to 3 speakers today. So thank you, Alan, Dalbeer, and John Paul, who's now gone. And thank you to everyone for joining. It's great to see so many of you here. Just want to keep an eye out for the date. So we're going to be running another one of these webinars focused on physical activity, actually, on the 20th of March. So the invite for that will come. But please do keep an eye out for that. And that will be over lunchtime during the 20th of March. So thanks very much, everyone, and see you next time.